Good morning, Mrs. Whitman.
Hello, Kathy, and good morning, Mrs. Smith. I am Kathy's clinical instructor. Do you mind if Kathy and I discuss some aspects of your nursing care?
Hello, Mrs. Whitman. No, not at all. Kathy has been so good to me today. I was just getting up to go to the bathroom. I will be back in 1 minute.
Tell me, Kathy, what is your nursing assessment of your patient this morning?
Mrs. Smith is a G3P2 at 38 weeks in early labor, 3 centimeters dilated, and -4 station. I think she may have spontaneous rupture of the membranes.
Can you tell me more, Kathy? What makes you believe Mrs. Smith has ruptured her membranes?
Well, on my morning assessment she reported leaking some fluid. I know women can experience some urinary incontinence, but this happened after she had emptied her bladder.
What else might cause a pregnant woman to experience vaginal fluid loss?
Let me think. Perhaps increased vaginal discharge due to cervical changes as a part of early labor?
Good, Kathy. Firstly, the most important thing to rule in or out is whether Mrs. Smith does indeed have ruptured membranes. Can you think why this is?
Well, it may be because she is at higher risk of infection.
Yes, this is true, but of greater immediate concern is that with a high head, there is a risk of cord prolapse. A vaginal exam should be performed and the fetal heart assessed. Kathy, you have shown a good understanding of some of the reasons a woman might experience vaginal fluid loss. However, I'd like you to go escort Mrs. Smith back to bed, and immediately inform her nurse of your assessment findings. After that, I'd like you to look up the unit protocol on ruptured membranes. You can report to the rest of the group in post-conference what nursing care is recommended as a best practice. We can all learn from your experience.
Thank you, Mrs. Whitman. Now I understand the risks. I will do that immediately.